It's all in your head. These 5 words have shattered the trust of countless patients seeking help for their pain and suffering. Medical trauma affects up to 25% of patients, with even higher rates among those battling chronic pain. Stay with me to discover powerful strategies that can transform your medical experiences from anxiety inducing to empowering experiences. Greetings. It's nice to see you, and those that are new here, you're very welcome. Let me share my personal experience with medical trauma and anxiety. For 3 decades, I lived with complex regional pain syndrome, also known as CRPS, a condition that caused constant burning pain throughout my body and the loss of my dominant hand. While today there are more treatment options and better understanding of CRPS, back then I had to prove I was still disabled every 6 months, as if this challenging condition would suddenly disappear on its own. Each time I'd face the anxiety of paperwork, appointments, and the fear of being disbelieved. The cycle of proving my disability created deep medical anxiety and trauma. Living with chronic pain creates a perfect storm for medical trauma. The exhausting cycle of seeking help, facing dismissal, and continuing to suffer can leave deep emotional wounds that impact both mental and physical health. Many chronic pain warriors report being labeled as drug seeking, having their symptoms minimized, spending years doctor shopping to find someone who believes them, developing anxiety and PTSD from repeated negative healthcare experiences, and feeling isolated within the medical system. Medical trauma manifests in surprising ways. There can be panic attacks before appointments, physical symptoms like elevated heart rate in medical settings, difficult communicating with providers, avoiding necessary care, and experiencing flashbacks. Many patients feel powerless and struggle to trust even supportive healthcare providers. Let's focus on 2 powerful mindfulness techniques you can use immediately to help you in these situations. The first one is the 3-3-6 technique. You discreetly count to 3 while gazing at any object in the room. Take 3 normal breaths while maintaining that focus. Then count down from 6 while letting your shoulders gradually relax. This subtle technique can be used anytime without drawing attention to yourself. The second one is object focusing. Bring a small, meaningful object to your appointment. A polished stone, a worry bead, a small crystal, even a fidget ring or a textured coin. Anything pocket-sized with interesting tactile properties. When anxiety rises, hold this object and focus entirely on its physical properties, its weight, texture, and temperature. This grounds you in the present moment and away from trauma responses. You don't need a professional advocate to have support in this situation. Ask a friend or family member to join your appointments after helping them prepare to support you by creating an appointment checklist together that can include current symptoms and their impact on daily life, timeline of when problems started or changed, questions about diagnosis and treatment options, current medications and their effects, treatment goals and concerns, follow-up plans when needed. Make sure to brief your support person on how to help by taking notes during the appointment, asking for clarifications when things aren't clear, helping you remember prepared questions, and signaling when you appear overwhelmed and need a break, and finally summarizing key points before leaving. Another option to consider is telemedicine. It offers a gentler way to access healthcare. You can receive care from home, avoid triggering environments, take breaks easily, and have support people present without restrictions. While not perfect, some symptoms can be missed and technical issues can occur. It provides a valuable option with more comfortable and accessible care. Remember, your experiences are value, and you deserve compassionate care. By combining mindfulness and pacing yourself, or even taking the telemedicine option, you can be more comfortable in dealing with getting health care. And I'm really wishing you a comfortable week. And I really do hope that addressing this whole concept of anxiety and trauma around medical care, you have found it useful. And if you have, please leave a comment.